What is drug addiction? Addiction is a disease that affects your brain and behavior. When you are addicted to drugs, you cannot resist the urge to use them, no matter how much harm the drugs may cause. The earlier you get treatment for drug addiction, the more likely you are to avoid some of the more dire consequences of the disease. Drug addiction is not about just heroin, cocaine, or other illegal drugs. You can get addicted to alcohol, nicotine, sleep, and anti anxiety medications, and other legal substances. At first, you may choose to take a drug because you like the way it makes you feel. You may think you can control how much and how often you use it. But over time, drugs change how your brain works. These physical changes can last a long time. They make you lose control and can lead to damaging behaviors. Addiction versus abuse and tolerance. Drug abuse is when you use legal or illegal substances in ways you should not. You might take more than the regular dose of pills or use someone else's prescriptions. You may abuse drugs to feel good, ease stress, or avoid reality. But usually you are able to change your unhealthy habits or stop using altogether. When you use opioids for pain for a long time, for example, you may develop tolerance and even physical dependence. This does not mean you are addicted. In general, when narcotics are used under proper medical supervision, addiction happens in only a small percentage of people. Effect on your brain. Your brain is wired to make you want to repeat experiences that make you feel good, so you are motivated to do them again and again. When you use drugs for a long time, it can cause change in other brain chemical system and circuits as well. They can hurt your judgment, decision making, memory, ability to learn. Who's most likely to become addicted? Each person's body and brain are different. People also react differently to drugs. Some love the feeling the first time they try it and want more, others hate it and never try again. Family history. Your genes are responsible for about half of your odds. If your parents or siblings have problems with alcohol or drugs, early drugs use, children's brain are still growing and drugs use can change that. So taking drugs at any early age may make you more likely to get addicted when you get older. Mental disorders. If you are depressed, have trouble paying attention, or worry constantly, you have a higher chance of addiction. You may turn to drugs as a way to try to feel better. A history of a trauma in your life also makes you more likely to have addiction. Signs of addiction. You may have one or more of these warning signs. An urge to use the drugs every day or many times a day. Taking more drugs than you want to and for longer thought you would. Always having the drugs with you and buying it even if you cannot afford it. Spending more time alone. Not taking care of yourself or caring how you look. Most of your time getting, using or recovering from the effects of the drugs. Feeling sick. Feeling sick when you try to quit. How to prevent addiction to prescribed painkillers. Most people who take their pain medicine as directed by their doctor do not become addicted, even if they take the medicine for a long time. Fears about addiction should not prevent you from using narcotics or relieve your pain. But if you are abused drugs or alcohol in the past or have family members who have, you may be at high risk. To avoid pain medicine addiction, take the drugs exactly as your doctor prescribes. Tell your doctor about any personal or family history of drug abuse or addiction. This will help them prescribe the medicines that will work best for you. Remember, it's common for people to develop a tolerance to pain medication and to need higher doses to get the same level of pain relief. This is normal and is not a sign of addiction. With addiction, you may need to use higher doses, but it's not for pain relief. Still, talk to your doctor if this effect becomes troubling.